Here at home now, this week's recommendations on scaling back mammograms and pap smears have created concern and uncertainty for many American women. An expert panel advised against routine breast cancer screening for women between 40 and 49 and recommended that women over 50 have mammograms only every other year. For more perspective on that, we are joined by our medical correspondent, Dr. Jon LaPook. John, good to see you. Long week for you.
For sure.
I think it's fair to say that there has been some bashing of this panel by both patients and doctors, we should say, fair or not. We've had a couple days now to process what happened. What went wrong this week?
Well, Jeff, I think the task force had a very tough job. They had a very difficult analysis, a lot of statistical models, tough to understand. I even had trouble understanding them, right? And they're trying to make it understandable for the public. And something got lost in the sauce, I think, with the messaging. What they didn't say was that you're not allowed to have a mammogram at 40, or you can't have it every year instead of every 2 years, okay? They're saying it's up to the doctor and the patient. What would be terrible from my point of view as a physician is if the insurance companies now take this and say, we're not going to pay for this test.
You certainly understand the emotion here.
Absolutely, okay? On the one hand, you've got a public health issue. What's best for the nation? On the other hand, if you're the 40-year-old woman, you're thinking, well, what about me? Okay, I've got the risks of anxiety and the risks of a biopsy that I didn't need, and maybe a little bit of risk of radiation, although people think that's minor. And on the other hand, you have the risk of death. And that's frightening, terrifying.
Okay, so if we look past the understandable anger and confusion of this week, if we look a few years down the road, what do you see?
Well, I think one of the good things that's come out of this is that now there's more of a national conversation. And the task force does point out that there are some problems with mammography. It does save lives, but it's not a good enough test. One problem is that it picks up a lesion, but some of the times that lesion is growing so slowly it's not going to kill the person. Other times it's so quickly that it doesn't matter that you picked it up early. And then finally there's that last group where mammography definitely saves your lives. We have to figure out, how do you enlarge that last group? How do you do new tests, MRI, ultrasound, and things we haven't even thought of to increase the number of women whose lives are actually saved by a screening test?
And right now, easier said than done. All right, Dr. Jon LaPook, thank you very much.